Today we're talking about non-surgical rhinoplasty or liquid rhinoplasty. People call it different names. Why people do that? There are a couple of different groups of people who are a good candidate for this treatment, basically. Number one are the people who want to see how the result looks like before they pull the trigger and go get the surgical rhinoplasty done. They just want to see how it looks like, kind of give them like a visual. Second one are the people who cannot get a surgery for any kind of reason, for any kind of medical reasons, or the surgeon thinks they're not a good candidate for surgical rhinoplasty, but they still want to see some improvement so they can come and get the non-surgical rhinoplasty. And then some people who have done the surgical rhinoplasty before and they want to get some fine-tuning in the treatment, in the surgery, so they can come and get this non-surgical rhinoplasty. How's it done? Basically, we got to put the filler in the nose to improve the shape. The things that people have to know about that is that surgical rhinoplasty basically changes the nose from every different angle, but the non-surgical rhinoplasty, most of the time, not much is going to change when we look at the front profile. The more we're going to go to the side profile, the more we're going to see the result, basically. So the most dramatic change in the non-surgical rhinoplasty basically is going to be from the side view. Lots of times, actually, people with the wider nose, what they notice after the non-surgical rhinoplasty is that the light reflection is going to be a little bit more straight, so it kind of gives them the impression that they have a smaller nose, which is kind of interesting because we put filler in the nose, but the nose looks smaller. The best candidate for the non-surgical rhinoplasty is somebody, what we call it, with the Roman nose, that they have a bump right in this area. So we can go above that area and below this area to put some filler to make that a straight line. Asymmetry could be corrected, but it's going to be more difficult. But again, if they have a wider bulbous tip or wider nares, non-surgical rhinoplasty cannot narrow their nose, basically. If they have asymmetry, we can go try to make it symmetric, but if they're asking for a narrower nose, non-surgical rhinoplasty is not going to work on them. The procedure is very, very easy. It's yet very delicate. So it starts with the numbing of the nose, then the injection is going to happen. Usually this procedure doesn't have much of a downtime. In all the non-surgical rhinoplasties that I have done, maybe I have had 1 or 2 bruises. Usually even the bruise doesn't happen. Another beauty about non-surgical rhinoplasty comes back to the longevity of the filler. As we talked about before, fillers last a long time in the body. So with the non-surgical rhinoplasty, if I tell my patients, if you do it 2 or 3 times, you don't need to do it for a very, very long time. To be honest with you, most of my surgical rhinoplasties, I probably have seen them 2 or 3 times maximum. After the 3rd time, they usually are happy. They usually don't come back for many years. Almost becomes permanent.